So we have classified the pneumonias into no pneumonia, pneumonia. Now we'll find out what are the changes in severe pneumonia. Severe pneumonia is cough, fever, tachypnea and retractions. The last one, which is very serious, is there is cough, there is fever, there is tachypnea, there is retraction. In addition, the child is lethargic, he is not taking feeds, he has got cyanosis and is drowsy. That means the child is having very severe pneumonia. What is the point of classifying on WHO lines pneumonia into various categories? For everything, the treatment schedule and the place where they are to be treated depends. Like if a child comes with only cough and fever, then no other symptoms or no other signs are there, then we'll call it as no pneumonia. The child does not need any treatment except for symptomatic treatment, and this can be done at a domiciliary level. If the child is classified as pneumonia, he has got cough, fever, tachypnea, then he should be admitted. He should be admitted. No, he should not be admitted only for pneumonia. No, he should not be admitted because he has got only cough, fever and tachypnea. Body is trying to overtake, control the infection, and with little help from us, it will be able to overcome. So what is the treatment? This is domiciliary treatment again. In pneumonia, the treatment is domiciliary. That is, you advise the patient to be started on oral amoxicillin at 45 mg per kg per day in 3 divided doses. So this has to be given. If it is domiciliary, it has to be given for 5 to 7 days. Then we'll go to the next stage. The child was treated, he became alright, or the child may become worse because of various conditions. Because the child may be very young, or he may be infected with organisms which are not responding to amoxicillin, oral amoxicillin. Then what you have to do is, this should be admitted. They should be treated as inpatients. So what do we do after admission? You give him injection ampicillin 50 mg per kg per dose every 6 hours. Ampicillin is given 50 mg per kg IV every 6 hours. Okay. Then you have to also add gentamicin 7.5 mg per kg once a day. So this takes care of severe pneumonias. The treatment here is all inpatients should be given treatment for 7 to 10 days. Now we go over to the next, which is a severe form of pneumonia. Here the child has got cough, fever, tachypnea, retraction. In addition, he also has drowsiness, lethargy, poor feeding, cyanosis, apnea. So this is a very severe pneumonia. This child needs urgent inpatient and intensive care. So having admitted, we have to give all airway maintenance, then oxygen supplementation. In addition, we also should give maintenance fluid, plus in addition we have to give antibiotics in the form of injection, ceftriaxone 80 mg per kg IV or IM once daily. In suspected staphylococcus, you also can add cloxacillin at the dose of 50 mg per kg 6th hourly. So this is in short the management. But because these very severe pneumonia patients, usually they are hospital acquired or they come from community and they get secondarily infected in the hospital, we may also have to cater for all those staphylococcus which are multi-drug resistant to the cloxacillin. You have to add vancomycin, clindamycin or linezolid if it is MSRA. So having said that, this is the WHO classification of pneumonias, and this is the treatment, where it should be done, how much it should be done, like in domiciliary in case of pneumonia, and severe pneumonia you have to give inpatient, and very severe pneumonia you have to give intensive care. Now we'll go to, is there any way this patient has come, you have sorted him out and you have classified him, given appropriate treatment. Are there any ways where we can intervene in the community? Rather than treating the patient, can we prevent the occurrence of pneumonias. So it is broadly divided into, we have to find out what is the age of the child, what are the likely organisms, what are the comorbid conditions, and what are the available facilities. Depending on that, if you go by WHO classification, we can prevent from one category to going to other category by timely intervention. In addition to that, we also to improve that periodic antigen challenges amongst viruses. Viruses are one of the causes which may result in, which can be prevented provided you take all the precautionary measures. And their immunization against various viruses may not offer effective resistance against infections of the surface mucosa of the respiratory tract. Okay. Lack of treatment in viruses limits our intervention strategies. Okay. So in addition, there are non-specific measures which can prevent or retard the development of pneumonias. One is improve the socio-economic condition. You give health education to the mother and to the family members. Decrease in overcrowding, and improve the nutrition. Promote breastfeeding and avoid exposure to indoor factors. Then you have to see that the child is immunized up to date against measles, pertussis, diphtheria, and tuberculosis. So there are also other factors, other interventions which can result in prevention of pneumonias like pneumococcal vaccine, influenza vaccine. However, both are not accessible to the common man. Now a word about influenza vaccine. Influenza is a virus disease which is very common in temperate zones because of the ambient temperature is between the range of 9 to 15, and it usually occurs in the winter months. The season starts in the month of October, goes well into January. Now what happens is, the influenza is notorious. There are three types of influenza there: influenza A, B, and C. The influenzas which are prevalent, all of them does not require vaccine. There are only certain clinical underlying conditions like bronchial asthma, bronchopulmonary dysplasias, diabetes, and various pneumoconiosis, and various factors which are underlying. COPD, chronic obstructive airway disease, these are all the factors wherein the virus, when it comes, the body system is already having underlying morbid conditions. So these are the patients who require vaccine. Please remember, the vaccine which is to be given, it is prepared. Let us say you are going to give the vaccine in 2021. So the prevalent viruses are to be taken, and they are supposed to be sent to the virological institutions where the vaccine is developed, because the influenza vaccine has got a tremendous capacity to mutate. The one which is prevalent last year may not be the same now. So what you should do is, you take the virus, send it to the department that vaccine manufacturers. They will manufacture, and that will be starting manufacturing in the month of May, and it is ready for given in 2021. From October till December, the vaccination should be given to all those patients with underlying comorbid conditions. This is given every year. So, finish. No more time.